She's going to tell you an exciting collaboration between IIH UK, and without further ado, I'll hand over.
Thank you very much. Thank you very much, Amanda. Thank you for having me today. And I guess it is very timely, having listened to all the conversations and the talks already before, the elements of the work Melissa's doing that we sort of already embedded into our programs and the work we're doing, and also you know, the sort of healthcare professional, the research inputs that, you know, we've combined into the programs we work with. So I will also share a presentation. I hope people can still sort of watch and see where we at. I jumped at the beginning, apologies. So we've heard, I mean, the experience of Melissa's and, you know, experience of millions of people actually just in England alone, alongside, you know, living with a long-term condition of some form, some more visible, some more mainstream, some less so. And I guess the focus of the work we're doing isn't necessarily around looking at the condition itself, but looking at the emotional and psychological impact that living with such condition has on the person. But as we know, the condition doesn't affect just the person, it also affects the family and the people around them. So especially during the pandemic, we have seen large numbers of people becoming carers or finding themselves being in a caring position at a point when they weren't necessarily expecting it. And again, the commonality of it is that those people, of course, have to deal with sort of change of the focus from themselves onto someone else, and get into a sense of you know, helping, but also forgetting, as we often do, forget about our own health. And therefore we've seen a high decline in mental health and emotional well-being in many carers who struggled throughout the period where many services have been withdrawn. Of course, many parents who might be on the call here, the homeschooling elements and other things that just added to the pressure of what we already have to deal and go through in our lives. A little bit about us as an organisation. So we're a social enterprise based in Coventry. We have been founded, our organisation has been founded by experts, and you can see those experts on the screen. Professor Andy Turner, the one with the beard in the picture, has been working at Coventry University for over 25 years, researching self-management for people living with long-term conditions, mainly adults, and has successfully sort of done a range of projects looking at how best support and empower patients to manage their health better. That doesn't mean about doing it alone. Self-management isn't about doing it alone. It's having the skills and knowledge and confidence to sort of manage better, and rather than adding sort of years to your life, as we all live longer, is adding more life to our years. Now, Andy has always been a great advocate for co-design and co-creation. All of the programs that our organisation runs have been co-designed with people who live with the condition, of people who are affected by it, so the parents and carers. It brings in the views of the healthcare professionals and the social care professionals, and of course the latest research that is being published, combining it all together into a program that we have named HOPE, which stands for Help to Overcome Problems Effectively. And eventually, once the university has done a range of trials and publications on the program, Andy and as you can see on the picture, 4 volunteers from the community started a social enterprise that I am the CEO of now, and all of them had their own experience being parents of autistic children, living with kidney disease, being carers, and actually all of our staff in our organizations have got our own experience of living with or being affected by long-term conditions in some way. We've also got a mascot, Heritage Dog, who you can see there, who's, as we say, you know, Jack Russell, who are known for their sort of tenacity and for their sort of keep going attitude, and that's what we try to sort of distill in our programs. So the program that I'm going to be talking about today is called the HOPE program. As we, it's being co-created with users. It's a 6 to 8 week self-management program. It offers people to try out a range of evidence-based activities and things that were stemmed from research, but also very much what people have told us that works for them. During the pandemic, all of our delivery shifted very much so from face-to-face to online delivery. We already had online delivery prior to the pandemic because we understood from what parents and carers have been telling us that for them, actually, there were massive barriers just to come to any sessions or to attend any weekly meetings, and therefore we've built an online platform for them. Now, this is our areas of expertise in which we work with. Peer support is the key thing. The element of what we hear mostly from parents and from people we work with is about feeling alone, and actually that sense of coming together with people who live through the same day in, day out, that really understand and can empathize is very important. And this is not just from the people who come on our courses, it's from the people who deliver the courses as well. And that is very important for us. So these are the areas we operate in, and we are trying to really address the root cause by just enabling people to manage better in the world that, where diagnoses take a long time, where you might have to be waiting over 2 to 4 years for certain diagnoses, not necessarily for yourself, but it might be for your children and others, which affects our mental health overall. We have to date, since we were founded in 2015, supported 16,000 participants across the country, some internationally as well. We've seen from the trials and the evidence that we've collected that we see improvements in depression and anxiety, improvements in people better managing their mental health, and as a result, reduction in use in services. We have a range of the HOPE program courses available. Here's some of the list that is mentioned there. You can see that there's some parent groups we focus on specifically, some carers we focus on specifically, and certain conditions. But whilst we use those labels, or whilst we use that, we generally in the program don't focus on the condition, we focus on the person and their well-being. These are some of the partners that we've been working with. We're a small organisation, however, have got a wide reach through the fact that we work in collaboration and that organisations take over or sort of grow the HOPE program. We co-design it with the people they work with, we co-design it with healthcare professionals, and then we pass on that ownership of the program and work together, hopefully in long-term relationships where we keep on building on the evidence base and we keep on building on making sure that the program is available for as many people as possible. Now, I am really pleased, and thanks to Amanda and Shelley and everyone in IIH UK, that we're able to add the IIH UK logo to that sort of partner element. And that is because we've got some exciting programs coming up. It was interesting, my conversations I had with Amanda. Amanda had attended one of the HOPE programs run for parents of children with complex needs, I believe. And that's how she approached it, to say she'd like to sort of look into the possibility of co-designing the program specifically for yourselves. And it was interesting to see from the research that Amanda and IIH UK have already been doing, that the terms that we hear from parents and carers and people who live with different conditions are very much similar in that sense of feeling isolated. Like you can see on the left there, that was sort of a word cloud created from the data that you have provided. Feeling isolated, find difficult, suffering, potentially not feeling understood, and not being trusted necessarily, which with some of the healthcare professionals. And we address communications with healthcare professionals and other things on the programs that we run. But I'm really excited to say that we've agreed that we will run a HOPE program for parents. This will be set on a date. We've put a preliminary date of 20th of September, and I will tell you a little bit more about how to, if you are interested, to register on the course. And we're also currently submitted to JoinBit to get funding to co-design the program for yourselves, where we would ask you to come to a number of groups, tell us, and we will listen what really matters to you, what are some of the strategies you've already used to manage your own well-being. We will bring experts together as well, social and healthcare professionals, ask them to understand if there's interlink, or if there is commonality, or if there are things that we need to address. We've heard from Pooja earlier, is that sort of the more knowledgeable our healthcare professionals about your condition, the more you can say the more you can tell them about your condition, that communication becomes much better, so that you feel empowered, that your voice is being heard, and the healthcare professionals are sort of equipped to be able to help you in that instance. So we're embarking on this wonderful journey, but before I jump to the details of telling you how to join the program, if you are interested, or share it with any other parents or carers that you might know about, I thought I'd share a bit of detail about a study we just finished with Coventry University, working with parents of autistic children. I appreciate this is a different group. However, I think there are some similarities and synergies between what you might be going through and what they have been going through. So we ran a small randomized control trial last year during the pandemic. We identified that parents, their mental health and well-being suffers already. When we worked with them before, we understood that actually the suicidality levels at parents of children with autistic children were higher, and often, the autism diagnosis took 2 to 4 years to get, and once the diagnosis was in place, the support that was available for the parents' well-being was often very limited. So we've heard from parents and ran over 30 courses locally in Coventry and Warwickshire with volunteers who were parents as well. We've seen some great improvements, great results, still link up with the parents now 7-8 years later. But one of the things that the parents have told us was that they couldn't access the programs. So we've built a digital program in partnership with carers just locally, and this was the randomized control trial that we ran last year during the summer. Now, this is just the Carers UK report from last year. I'm not going to go into the details, but ultimately, we cannot deny that the pandemic has had an impact on parents and carers significantly, and some of the care services are still not back to where they were or not provided how they were, and that sort of mental health and well-being elements of support are required more and more. These are some of the reasons why parents have told us that they joined the course, and often you will hear this, whether you're a parent or whether you live in the condition, you often feel that, you are the only one, because you don't know where to meet others. You might meet them on the Facebook groups, like we've heard, they'll be your only lifeline. We see this especially now with the long COVID diagnosis. It's happening again. People are just trying to find desperately other people who are in the same situation, and that's what the HOPE program does. It brings the people in the same situation, and often we hear that they all meet as strangers but leave as friends. This is just, again, just to showcase whom we had. We had range of ages between the parents and the carers. We've had them covering pretty much the whole of the UK, people from deprived areas, more affluent areas, a mixture of, come into the digital program at the time of need. We had 414 parents on the courses overall. So what we did is we've randomized a group of parents and carers that received the intervention straight away, and then those who received the later one 6 weeks later, because our intervention is 6 weeks. So we've collected range of data, and this is, I guess, for us was really interesting. This was the first randomized control trial evidence that we were collecting on our courses. And what was interesting, that we saw that the mental well-being of parents and carers was low at the beginning. And as you can see, showcased there, the orange line, or the line that is the lower one, for those ones who might not recognize the colors, the lower one is the group that waited for 6 weeks. And you can see that the group that has been on the course straight away has had a significant improvement in mental health and well-being, as measured by one of the clinical outcome measures. What was also positive for us to see, that the parents who were on the course, again, that's the blue line or the lower line, have had a significant reduction in depression compared to the group that waited. And the same result we see that was in anxiety, because anxiety levels were again more prominent in parents than we've seen before. So whilst there is a slight improvement in the control group, the group that waited, it isn't significant in terms of research terms. But those are just numbers, and the publications are due to be published by the research team that we work with at Coventry University. But I guess the feedback we collect is on the usability of the platform that we use, the course, the accessibility of it, but also just how it has actually affected and changed people's lives. And Nicola has sort of volunteered herself to write a study at the end of the course for us, a case study, and share a story of her son Elijah, who was diagnosed sort of 6 years ago. And she did have a tough time, absolutely did, like many parents on the courses. And it did take a lot of persuasion to actually allow herself and give herself that permission to actually do something for herself. But once she started, she went into the course, and you can read from the words on there that, you know, she never realized that simple things that we sort of ask people to try on the course has actually helped her to change of thinking more positively rather than negatively, and actually focus on herself. And this drawing, which is what Nicola has sent us after, was for me really that sort of evidence of the work has done, the course has done what it needed to do, because this course isn't about parenting. This course isn't necessarily giving you all the information you need to know about your child's IIH condition or else. This course focuses on you, because as you know, we can't travel much, but you might remember the saying on the plane, you put your mask on first before you help others. And that's exactly the position many parents found themselves in that time. And the fact that she has put herself, me, in the center of her drawing, really for us was to showcase that the shift in thinking about, in many times we feel guilty about doing things for ourselves or putting ourselves in the middle, but ultimately it has a more positive effect on ourselves and also on the care. So now to the announcement. So as Amanda mentioned at the beginning, she very kindly set up a Hope email address, which is there noted at the beginning. What we've also done is already created a sign-up form for those who are interested to register for the course starting in September. The date is provisional, but you know, it's only if we found that the date doesn't work for others, but you know, it's unlikely to change unless we have some major change happening, but we would keep you in touch. So if you know any parents, if you're part of any groups, if you think you want to give it a go, I would suggest that you do register now. We'll be in touch with you later on. The reason why there is such a wait in time is because we know that summer isn't a time when parents would have much time for all else. So that's why we're starting that in September, when the schools are back in, and hopefully parents will have the time to fit around their busy lives the Hope programme, which is delivered. And through the sign up link, you also get more information about what exactly is in the course, how the course works, so learn a bit more about what you need, how it is accessible. Amanda and I, as soon as and IIH UK, and as soon as we hear about the co-design and that work, we would be using that Hope email as well to sort of get people to register, sign up for some workshops to help us co-design those elements. And in relation to just give you an overview about what is on the Hope programme, we ask you to be introduced setting smarter goals, where you set yourself a reward. We look at stress management and fatigue, which is often very important, both for parents and people living with a condition. Elements around gratitude, just things we've got daily in our lives, just little steps and little things that you can try. And on the Hope programme, we take an approach that you can try everything or nothing. It is completely up to you. But the main important part is that the expertise and the questions and the areas of communication you might have, you bring that to the course, you share it with others. And on the online platform, you can do that through an online forum, chats, discussion topics. We also bring you together in a live session weekly if you want to see each other, because the course is delivered sort of around your time, it's not live. And maybe it might be an opportunity to bring in some experts as well to sort of do some Q&A sessions like you had earlier on. So all those things are available. In session 5, we cover creativity. Melissa's work was really amazing. So I would suggest that, you know, if we can share any of the work on the course to sort of showcase, we would really make it as tailored as possible to yourself. And that's it from me. So I will stop sharing and bring you to any questions. I hope I haven't gone too much over time.
No, not at all, Gabriella. And just to say a phenomenal thank you for your time today to come and talk about the Hope programme. There are a couple of questions and to go to you, and also I'd just like to share a little bit more about what we're going to be doing together as well. The first question is whether the programme is open to people from only specific areas or whether it's open UK wide. And yeah.
Sorry, do you want to answer that, Amanda? You can.
No, it's fine. I'll let you answer it.
It's UK wide. Yeah, absolutely, UK wide. We don't have the postcode lottery. Luckily, in this one, we can offer it to anyone who they are, wherever they are. We've gone as far as Shetland Islands and beyond. So I guess internet connection is needed. That is probably the only downside, but that enables us to sort of have that wider reach.
Yeah, and I think that's going to be one of the real strengths of the programme, especially with rare conditions such as IIH for parents, but also for adults with IIH, because I know from my personal experience, I still haven't met many people in my area who have IIH. And that's one of the things that can be so isolating for me, having a rare condition. But actually, I was lucky enough to undertake the Hope programme, not for IIH, but for as a parent of a child who has some additional challenges. And it was over lockdown, and carrying it out virtually, I've made such a fantastic group of friends, and we've continued on sharing our journey together with our children, and it has been a phenomenal experience for me to take part in that. And I knew as soon as I did it that it would be something that would be of benefit to people with IIH. So we're hoping that we can create this virtual community across the UK that adds to the support groups that are out there, but allows you to delve much more into management of yourself as well. Just looking at other questions in there, is I can see that someone has asked about hoping we get the funding for adults as well. Just to fill you in on the detail, we're really hopeful that we'll get the funding as well. The funding has gone into the National Lottery, and IIH UK is supplementing that grant request that we have. So we are hoping that we will find out about it in the next 6 weeks. So watch this space, and then we will be announcing the next steps to take it forwards. I think what's really important is that the programme is going to be co-created, as Gabriella said, with people with IIH. So we are looking for people with IIH, and there will be lots of opportunities to take part in what the course becomes and how it evolves. Is that correct, Gabriella?
Absolutely. So we would normally hold sort of 2 groups of about 6 to 8 people. It is likely we'll have to do that virtually, but hopefully that won't be too much of a barrier to too many people. We could also collect, obviously we'll draw on the research Amanda and IIH UK have already done. We then will try to bring a group of professionals, healthcare professionals, social care professionals who work in this area as well, to sort of give us their sort of views as to what's most needed to support the health and well-being of those affected by IIH UK. And we will then sort of do a logic map of our clinical psychologists and our researchers work in this area. You can tell my terminology isn't as polished as theirs would be. However, they do sort of something that to me looks like magic, which is combining all the key areas, and then more importantly, they trawl through the latest research and they pick out the elements of what we know that has worked in different places, what we can introduce. We then run a pilot course sort of with the first group and find out how they felt about it, what else could be added. And really the work doesn't end there, because the co-design actually goes on as the courses run. We do have discussion topics, ask people how they manage, what helps them. We draw that information then and update the courses to make sure that other parents, other carers, people with conditions learn from what you have shared that has worked for you. And because that's the most important element, because you live it day in, day out, you know best. We can only find certain limited information, but really that is that sort of element of hope and their ownership of everyone. And I just like to highlight around the creativity element as well, that it would be really great to have parents and others joining the courses. As you know, Coventry, or you might not know, Coventry is the UK City of Culture 2021. And we will be running something called a Hope Punk exhibition, which will be both virtual and physical next year in February 2022. And we're hoping that we encourage those people who are on our courses to share what hope means to them through whatever means of creativity. We've already had some pictures of bakes submitted, knitting and artworks to certain elements. And again, it's just that sort of expression of what it means for them to live with the condition, but also the element of hope, how the course has helped them. So that will be some exciting stuff happening.
Fabulous. And I'm sure we will be able to bring our new arts and culture rep, Mel Fisher, in as part of that co-design process, and use Mel's expertise between art and science as well will be fantastic. Just having a look to see any other question. There was a question about the links for the group. It's going to be added in there. I know Claire's working on adding the link to be able to sign up in there, but we will also be sharing that on social media after or during the event today as well, so that people can sign up for the programme. I think one area that would be really useful just to mention briefly is that as part of the grant application, we are hoping that people with IIH will be able to become facilitators of the Hope course as well. So we are looking for people who are interested in helping as facilitators as part of the Hope programme in the future as well. Okay, are there any other questions from anyone on the chat or any of our panelists that we have listening in? If you could let me know, otherwise we're going to move to a break now, which will be until 11:30, and then we'll be back after the break with Dr. Sui Wong talking about group consultations for people with IIH. But once again, an enormous thank you to Gabriella for joining us today. Really appreciate giving your time up for us, and we are phenomenally excited about starting the Hope programme in September. Thank you. So just a reminder, break now until 11:30, when we will be back with Dr. Sui Wong. Thank you.